What's that? You can't breathe?
Yeah, she keeps saying she can't breathe.
Okay. Are you having pain in your chest too, or no? You just feel like you can't breathe? Okay. Yeah, I guess she failed her swallowing test yesterday,
Yes.
so.
So what does that mean?
Well, it means it's not safe to give her anything to eat because she may aspirate that. And that's part of why she had so much cough and all that congestion. And it has helped because now her white cell count has come from 18,000 all the way down to 11,000 since we withheld food. Unfortunately, though, that brings us to a difficult spot because if she can't swallow, then the only other way to provide nutrition would be to put a feeding tube in her stomach. That's a peg tube. The speech therapist says she'd come back and reevaluate. A lot of times, if a patient um, improves a little bit, then the swallowing function can improve also. But it's not really clear, if that's going to be the case here.
They gave me something last night. I don't know what it was. Put it in the vein.
Yeah,
The
something
IV.
from medicine, some Ativan, it looks like. Did that help? They said.
Yeah, I don't remember it.
Yeah. Yeah, I think we can continue that because I think if you're anxious or you don't feel so well, that might help to relax you, especially now with the breathing. It's not so good. So
I have some.
yeah, I can order some more.
Mom, do you want a feeding tube?
Huh?
Do you want a feeding tube in your
No.
stomach?
No.
I didn't think so.
Yeah, I guess at this point, the other option would be to focus on comfort. To keep you comfortable through this. If you wanted to continue to try and eat, you could. That's your choice. We can't keep you from that. Our advice would be not to, but I understand a personal choice not to have a feeding tube.
Doctor, all I want is to be kept comfortable.
Okay. Yeah, I understand that. That's a very reasonable thing to say. Yeah.
I'm 96 years old,
Mm-hmm.
and I'm ready to go.
Okay. Yeah, I understand. I respect that. If that's obviously okay with the family.
The family is ready for
Yeah.
that as well.
Okay. So what I
We've
think
all
we should
talked.
do, I can consult our palliative care service, and they kind of specialize in this thing, or they help guide us, in sort of this end of life kind of care and comfort care. So I think that probably would be a good thing. Do you want to still try and have what we call, like comfort foods if you want to try to eat something?
I just want to be calm. I don't want to suffer.
Yeah.
That's what I'm doing now.
Yeah, I understand. Okay. Yeah, so we'll have medicine available for pain, for any kind of anxiety, or even the breathlessness you're feeling. There's medicine that will address that. So now, obviously, that's going to bring a little more of the sedation that we saw,
That's
but I
fine.
think that's, I
I
think that's
don't want her to
acceptable.
be choking to death or anything like that trying to eat food.
Right. Yeah.
Yeah, the sedation is fine.
Mm-hmm. Sure.
We've all talked to her. She had a good day yesterday. All the family was in, and we
Mhm.
were able to talk to her. So we have all said our goodbyes. Whatever
Okay.
needs to be said.
Right. Yeah.
My sister's coming in this morning. She should be here about 10.
Okay. Yeah. I
But-
think.
Well, leave my family. That's all I'm doing.
I know, it's hard. But I think I think you're right. You've lived a good long life, and if you've gotten to that point where you're kind of suffering, I think it's for the best to focus on the comfort rather than, suffering.
This is no life.
Yeah.
She knows where she's going when she dies,
Mm-hmm.
and we have comfort in knowing that.
Loving husband. I hate to leave him, but he don't be around me either.
Mm-hmm. Yeah.
And you know we'll take care of Mac, Mom.
Please do.
We will. You know that.
Okay. Yeah, let me write some orders in so we can get you some more medicine and we'll get that going.
Okay.
Okay.
Right.
All right. Let's let Carrie know, if you need anything else, but we're gonna again concentrate on the comfort, so we'll have medicine available for any pain or anxiety or Okay. Okay. You're welcome. Okay.
Thank you, Doctor.
Sure.
You're wonderful.
Oh,
we
you're
we
welcome.
love you.
You're welcome.
You're awesome.
All right.